So, welcome to another edition of the Cultivating Tradition podcast, and I couldn't be happier to be here than with Paul Johnson, who's a long-standing member of the British Acupuncture Council, but more importantly, he's my teacher.
Yes, what I did.
Who's my teacher? Well, you're always my teacher, Paul. So when I first started, Paul taught at the London College of Traditional Acupuncture, where I studied. Now teaches at City College of Acupuncture. I also had the privilege of working alongside you later on in my career as a clinical practitioner as you've
Ascended to the upper echelons of the business.
So I have a lot of questions I want to ask, but I'm absolutely fascinated. I mean, one of the things that I've really appreciated about you, Paul, is just your dedication to just moving forward and clarifying your approach throughout your career to a point where now when you teach it, it seems so clear to us. And some of the questions I want to ask are about people who might be curious about studying acupuncture, or new graduates who are looking to hone their craft as well and get some of your pearls of wisdom. So my first question is for people who may be interested in studying acupuncture. You've had a nice long career. What would you say to someone who's looking to study acupuncture, and what are the main areas of satisfaction that you've had from your career?
Okay, well, the first thing I would do is tell them that it's going to be really hard. It's going to be the hardest thing they've ever done in their life. And when I speak to people who are thinking about coming onto one of the BAAB acupuncture programs, I will always say to them, I don't care if you've got an MSc, I don't care if you've got a PhD, this is still going to be the hardest thing you have ever done in your life. And when I speak to people who are qualified, they go, yes, you were absolutely right. This was the hardest thing, because unlike many other subjects, it's the breadth of things that you're going to have to take on board is incredibly wide. Yeah. So first of all, it does take dedication. However, I would say that dedication is really going to be repaid once you are qualified, because it is the most rewarding job I've ever had. I've had other jobs previously. I was an illustrator for Marvel and DC Comics for 15 years. I was a music journalist, all that kind of thing. And I love those jobs. They were great, but I mean, they weren't as rewarding as being an acupuncturist. I feel blessed every day that I can get up, I can sit at a desk. I don't need a whole load of equipment around me. All I need is my needles and my bed, and people will come in and they will talk to me. I will listen, and I will look at their tongue. I'll take their pods. I will put them on the bed. I'll treat them. They'll go away. I'll come back the next week and they will say, hopefully, what a fantastic change has happened. So it's a very rewarding job, because you will help people in so many different ways. People will come in. Something will bring them in through the door. If it's a musculoskeletal problem, or they're suffering from anxiety, or they're not sleeping well, or they've got a gynecological problem, painful periods, that kind of thing. But once you start treating them, it will impact them in so many different ways. And I was a couple of years ago, I was treating this really lovely guy who was in his 90s. He was an ex-RAF pilot. He'd been flying into Berlin during the Cold War, so he was flying in and out of Berlin. He came in with a shoulder problem. He always wore a three-piece suit, clipped English accent. And I treated him for his frozen shoulder. And I think on the third or fourth treatment, he said, my shoulder's so much better, but, thank you so much for all the other stuff. And I said, well, what do you mean? And he went, well, I feel much more relaxed, and my sleep is so much better, and my digestion is really good at the moment. And I really thought it was great that someone from that generation could actually tell the difference of his quality of life in terms of having come for a musculoskeletal problem, but having felt the kind of systemic effects of acupuncture. So it's a really great career in that you will interact with people, and marvelous things will happen.
Yeah. I mean, I think one of the things we were talking about beforehand was just how we unpack the depth of what it is that we do, how we explain that in a few sentences. It's really hard to communicate.
Yeah.
And and I will echo what you said about the challenge, but I think it attracts a certain kind of person, because it's a left brain, right brain thing at the same time. You have to learn the logical side of things. It's intensely logical, actually, what we do. but then you have to develop these practical skills and the feeling aspects.
Yeah.
For me, the feeling was the area that I've had most development in. But that was a joy because it was a challenge.
Yeah.
But now I have a feeling sense I didn't have before because I developed that through the training, which is really, that's been a beautiful thing to have. It's,
Acupuncture is kind of half a science, half an art. And when you study it, then it needs to be that way. You know, you need to be looking at all the contemporary research, but also you need to look at classics, and you need to be embracing the fact that acupuncture has been around for millennia and has passed through so many different cultures and has absorbed so many different ideas. And so what you're working with is this incredible mixture of ways of helping people to get better.
so there are going to be some people maybe who have recently graduated, and when you learn your course, particularly when you do one of our accredited courses, course at City College, you get fantastic education. You're really ready for practice when you come out. But it is also something we develop as a career, right? We develop as a practitioner, and we hone our craft in a certain direction. If you could go back in time, Paul, who had just graduated, I don't know if you want to say how long ago it was.
26 years ago.
26 years ago. What would you tell Paul back then? Now you've had this whole career experience. How would you talk to him about how to develop?
Okay. Well, the first thing I would say is don't be hard on yourself. Give yourself a break. When you first leave college, everything is incredibly complex. You may have done your year of kind of clinical practice, but it's still, once you get out there, it's still, you're going to struggle sometimes to come up with a diagnosis. You're going to forget what a point is. You're going to do a treatment which you think is terrible. Don't beat yourself up about that. That's just part of the natural process. All this will come with time. The more experience you get, the greater depth of understanding you'll get. Everyone, when they first qualify, they're going to research every case they've done in great detail. They're going to absorb so much more information. Information no bigger than previously, but it probably hasn't gone in. It's when you start treating people that the information that you already know is reinforced, and that gets really, really deep. Yeah. So I would say just give yourself a break and realize that you're on the start of a really long path, which, even now, 26 years on, I go down here, I study something that's great. I think I'm getting somewhere. I look around a corner and it's, oh my God, there's a whole area here. I never looked at. I go down that area, and then I'm just getting a kind of a feel for that. And suddenly there's something else. So, we're all on this continual path. So that's the first thing. You've got to give yourself a break.
Yeah, 100%. And I think that there's a joyful part that you're always developing.
Yeah.
It doesn't mean to say that you don't achieve some real level of competency, because and I think that sometimes, it takes someone else observing you to realize it. When I'm first having student observers in my clinic, and I was very self-critical about myself. I just noticed the things I could have done better. But the students started telling me, oh, you were doing this, you were doing that. And oh, I could see you did that to make the patient more comfortable. Well, that was clever. And so, yes, so it's two things to be true at the same time, that you can keep developing, which means I can't remember the last time I was bored doing this, but also you do get competent. You do find a place where you can say, yes, I can treat this. And,
Yeah. I mean, even in our college, when the first year students come to observe the third year students in the teaching clinic, the third year students are often very negative about that until the first years actually come. And the first years come because the third years, nothing. And the first years come in and they just look up to them. And the third years suddenly realize how much they actually know. Yeah. So I wasn't denigrating the kind of the level of knowledge we have, but the important thing is to understand that there is so much stuff out there, and that will lead on to the kind of second piece of advice I would give, which is do lots of CPD, and try and study as wide a range of things as you possibly can. I mean, I found that worked for me personally. In what I did was I came out of college with my basic qualification. and I felt competent treating people, but I knew there was all these other avenues, and I went and studied with these people for a little bit, and those people for a little bit. I was in a Thai Harvey group for a year, all this kind of thing. And what you will do then is you will start to see what really resonates with you and what doesn't resonate with you, and that will build your own distinctive style. And I think that's what I'm saying about that kind of half science, half art business, is that you will make up, you will develop and become your own practitioner, and that's one of the rewarding things also, that you become. It's like it is like art, in that you become your own special person.
Yeah, 100%. And I think that there is such a life-sustaining thing of pursuing this goal of refining and uncovering. There's a kind of it's a discipline.
Yes.
You're perfecting something, just like you would if you practice an instrument or you any skill that you develop. And it gets to a point where, I mean, right now my holiday is my CBD. I just I look forward to learning with different teachers and just diving into it. That's how I spend my spare time. Yeah.
Yeah. And this is a caveat to that. My third piece of advice would be, once you are studying with people, you will come across people who are going to tell you everything you've learned so far is absolute rubbish. My style is the only way. I am the true holder of the flame. And you've got to throw everything away. You've got to spend the next 5 years studying with me, and I will teach you the absolute truth. And the thing is, acupuncture's been around for so long, and as I said, it's passed through so many different cultures. There are so many different ways of using it. Acupuncture, Chinese medicine, is like a map. It's a way of getting into a certain place. If you want to get to a certain place, there are so many ways to get to that place.
Yeah.
It depends where you're starting. And no one holds the truth. If they did, then everyone would be studying that one style. What's really amazing about Chinese medicine and about acupuncture is there's this multiplicity of ways of using it that all seem to work.
It's something that I've always appreciated about you, Paul, because I've done some of your CBD. I did your some of your gynecology work, particularly obstetrics, because I always found it tricky to know what shouldn't I be doing with pregnant patients, for example, which is a tricky area. It was an area you specialized in.
Yeah.
And I think that that practical approach you've taken to stripping aside, doctrines and disputes and things like that, and just saying, okay, but what are we looking at here? How do we find a practical way through?
Yeah.
And find a really a clear framework to actually approach these areas. Now, as I said, you taught gynecology, fertility, obstetrics. That's been an area of specialization, and some of our practitioners are generalists, some of them are specialists.
Yeah.
But I think it's an interesting topic. What is it about the idea of specialization that attracted to you, and fertility, gynae, obstetrics, and how would you talk to a practitioner about the value of specialization?
Yeah. Well, I didn't choose to kind of specialize. What happened was gynae and fertility in particular chose me, in that I had a practice in one part of the country and I moved somewhere else. And one of the very first people I treated there was someone who'd been told by her consultant gynecologist that it was physically impossible for her to get pregnant naturally. Now, she was having none of that. After 4 months, she was pregnant with her first child. She went on to have four children naturally. Yeah. So for me, that was a fantastic affirmation of the power of acupuncture. And of course, she told all of her friends, and they started to come. And then they told their friends, and they started to come. And I suddenly thought, blimey, I better do a bit more research about this. So I started going on courses and reading books and doing that kind of thing. And then suddenly, after several years, I realized that actually I probably knew quite a lot about this. And that's when I started running courses. So it wasn't so much that I chose it, but it was something that I fell into naturally. And I felt it was something that was kind of quite valuable. When I was first doing it, there weren't that many people offering it as a kind of specialism. I think if you're drawn to a particular area, then investigate it. But But also what happens sometimes is that I know some practitioners who've done lots of study and then gone into fertility, for example,
Yeah.
and then they've lasted a year or two and then they've pulled out because it can be very complex in terms of the emotional aspect. Once again, just have a look at what's out there. If there's something which appeals to you, then try it. If it works, then stick to it.
I think there is a real value as well of getting good at a certain thing.
Yes.
And then if you have, say, I don't know, 50, 60% of your patients are coming to you for that thing that you're quite confident in.
Yes.
It makes you feel a little bit more relaxed for the rest of the patients, where you don't want to be struggling with every single patient that you have. You don't want to be in that zone where, oh, what's going on with this patient? And equally, you don't want to be completely, not having to think about all of your patients. It's great to have, say, I don't know, 15, 20% of your patients that are in that gray zone that push you forward. And but having the bread and butter patients of the ones you know how to treat it kind of takes the pressure out a little bit.
I would never have wanted to have done that just by itself.
Yeah.
You're going to stay fresh and you're going to get new experiences by treating lots and lots of different conditions. That's what makes it interesting.
And whatever you specialize in, it's never just going to be that, because people come with their other things.
Yeah.
And people bring their family and their friends. Can you treat them for this and that? So you'll always end up doing a bit of everything, won't you? So
Absolutely.
yeah. So one of the challenges that we have, I think we all have at a certain point in our progress, is the theory is beautiful. And it feels completely true and real. So we have the sense of it. Yes, this absolutely makes sense to me. The way that mind and body are connected, and the way the medicine talks about how we use acupuncture points and everything. And so, but then actually making that have an effect in the way that it's written in the books, right? And to say there's a journey, and it's a finding the bedrock. It's finding something solid beyond the words. And I'm always interested that every practitioner seems to have found a different path to that. I wonder what that's been for you, Paul. How have you found a way to actually get down to this sense of, I have a sense of, I know what I'm doing is connecting to having an effect?
Yeah, there's two things immediately spring to mind from what you're saying. One of which is one saying is, Western medicine is very hard to learn but very easy to use. Chinese medicine is very easy to learn but very hard to use, because you have this basic set of really quite simple theories, but then you have to apply those in real practice. And another saying is, what comes through your door you may never see in a book. What you see in a book may never come through your door. So what you have to do is you have to find your way of using that information, and that's part of that whole beautiful part of the journey is working out what works for you. When I supervise in our teaching clinic, for example, I don't want to make the students clones of me. I've found a way of making acupuncture work for me, but that doesn't mean it's going to work that way for other people. Sometimes if something isn't going right, all the times I'm offering suggestions about how they might improve what they're doing, but really everyone needs to kind of engage and see what works for them specifically. Yeah. Sometimes if I'm feeling a bit cheeky, I can just, I always sit with the board next to me, and I can do something. I can write a point combination in one style, or you could do it this way, and I can write another, or you might want to do it this way, because there are so many different ways in, and each person will have one which really resonates with them, and it's a case of each person finding that.
So, you've been teaching for 20.
So when I qualified, I started teaching as an assistant in point location, and then very quickly became a teacher. Then I was running the module. Then I was running the college, and I've taught point location, Chinese medicine, clinical supervision, practitioner development, a little bit of research. Quite a lot of different aspects of.
So it's just, I'm really interested in this idea of seeing the students develop, right? So you're talking about, you're trying to push them in a certain way, You're trying to assist them to develop in their own way. And now you've seen generations go through.
Yeah.
Can you give some examples maybe of how you've seen students develop in different ways?
Yeah. I mean, as part of the program, we will teach what we refer to as the TCM toolbox. So, we're teaching that the 3 treasures, the 4 levels, the 5 elements, the 6 division, the 7 emotions, the 8 principles, all that kind of stuff like that. And you will find that some people are much more naturally drawn towards individual parts of that. And I think it's really important people understand all of that. But then some people, once they leave, they really take one part of that and they run with it. They might do more study on that particular area.
Yeah, I mean, it's such a huge, rich bed to develop into, isn't it? That you can just and this is one of the things that we you want to get your head around with Chinese medicine, because there's such a variety of approaches or emphasis that you can have.
Yeah.
On the one hand, it doesn't mean to say that 2 people working differently are any less valid.
Oh, no,
And then
no.
on the other hand, you also want to say, well, there is better and worse too, right? Because did the patient get better or not? It's like you have to measure yourself, and both those things are true at the same time.
There are different ways of using it, but it's not that any particular way is wrong, but it might be less right. And what you're trying to always be is more right.
Yeah.
You're always trying to get it to work.
And, one of the things, I really enjoyed being clinical supervisor at City College. It was such a fun time, and helping students through that. But one of the things that I realized that I was doing, which I hadn't really consciously thought about until I started teaching, was I'd take a patient and go, what can I know for sure about this patient? And it might just be one thing I can say, like they're cold or they're anxious, and once you start from that baseline, say, well, look, these are the things I know for sure. And well, look, if they're cold, warm them up, right? And then see what happens. And I think that there's this, you get this sea of knowledge, you get a lot of different theories and everything. But boil down to the essentials, because when you can move from that point, and then also, it's so interesting how patients tell you a story sometimes over the course of multiple treatments, so you don't get everything out in the first consultation. Yeah. So one of the things that we were also talking about was the difference between private practice and the kind of medicine you get from conventional medicine, which is in a very structured way. And many of our members are really interested in working in the NHS, and that's absolutely fantastic. What I find interesting about you, Paul, is you quite like working in private practice because of the ability that you have to express what you do in a very free way, in the way that you want to.
Yeah, I really like that. I'm in kind of a grey zone. I'm qualified, I'm insured, I'm a FBAcC member. So there's a whole kind of PSA umbrella, that kind of thing. So there's an understanding there that I'm operating at a certain level, kind of medically almost. Yeah, but then within that, many people who are coming to me because they have had bad experiences with Western medicine, or Western medicine isn't giving them what they need.
Yeah.
And I think that when they come to see me, they are getting a very neutral space. They're not getting the normal kind of reaction they might get from a doctor or from a consultant who may have them in the room for 10 minutes and get them out the door really quickly. What we do is as acupuncturists is very complex. And the way we use acupuncture is a very complex intervention. It's not just a case of, well, this is the diagnosis, these are the points, put the needles in, wiggle them, that's it. And that's one of the problems about potentially if acupuncture becomes sucked into the NHS. If you think about kind of Western medicine and drugs, the whole idea is you're taking the practitioner out of the treatment. Anyone can give that drug, can make the diagnosis, give that drug, and the result will be known, or hoped for. Whereas the way we work is completely different. We are a huge part of that treatment.
Yeah.
So it's the interaction, it's the making of the space and the time for that person to actually speak and be heard. The kind of interaction between people. It's the paying attention. It's once they're on the bed, finding the points, the whole sense of touch. it's really important as a practitioner to have a very calm and grounding sense of touch. People aren't touched very much. They may be touched by, family members, but apart from that, it's quite unusual to have someone who just put their hand on you.
Yeah.
They don't want anything from you. They're just there with you. And I will sometimes, as I'm just starting the treatment, I'll just be, stand there, put my hand on someone's arm and talk to them, just to ground them and and let them know that everything's okay. Then I can go ahead and do the choice of the points, the needle technique, all that kind of thing. There are so many different things happening. It's completely different from going into a room, having a nurse coming in, put needles, and then in the room kind of thing. And speaking to people who have tried to move into the NHS, they have found that they've not been able to offer that kind of all roundness which we will offer. I know someone who once was working in a NHS funded complementary therapy clinic, and the client would come in and they would be told what the client had to have done, and it would only be one thing. They would have 10 minutes, and the person would come in and they would be 90, and they couldn't even take their shoes and off and get on the bed within 10 minutes, and they just had a shopping list of hundreds and hundreds of things. The NHS is very poor at that, whereas what we can do is we are, rather than it's got a bad wrist, we go out with the whole person and say, well, yeah, they've got a bad wrist, but then all this other stuff going on as well.
Yeah, I think it's an interesting challenge, isn't it? I mean, because people say, does acupuncture work? And it's as if it's this thing that's living in the forest below.
In the past 20
right, exactly, yeah. But that question takes the practitioner out of it, right? So we're saying, does acupuncture work, rather than what you're doing, because and it's very hard to put a name on what it is, the composite of what we're doing and what we're trying to express. And in many ways, it's actually revolutionary, the approach that we're taking. And many of us feel strongly that actually what we need is a bit of a revolution in medicine, revolution in thinking. It's happening slowly. The catchwords like mindfulness are coming in and things like this. But they're catching up with us rather than the other way around, right? So things are starting to become clearer. And I think that one thing that I remember from my development, when I was probably being supervised by you, Paul, in the clinic, was first you get the sense of imposter syndrome, because you're sitting there with a patient, and it's like, whoa, they're looking to me now. I'm supposed to have the knowledge.
Yeah.
But what I started to realize is that if I was able to hold it together, there's a whole pile of things that are happening. Just two people sitting in a room, one listening, one unpacking their symptoms with the space and the time and the framework. It's very affirmative Chinese medicine, because the way that you encourage to explain your symptoms are in the way that you feel them.
Yes.
Right. So it is nothing that we say, oh no, you shouldn't be feeling that, or that doesn't match with me.
Yes.
And there's something that happens in that dynamic, which is it's almost, dare I say it, a sacred dynamic, in a sense of just, there's the person trying to help and the person coming for help. And there's something automatic that happens around that if you give it the space for that to happen. And it needs to have the space.
Yeah, just in a very simple sense. Sometimes just having people verbalize something that's going round and round and round in their head, pain they've got, or a relationship issue, or that kind of thing. Just the act of verbalizing it and then coming back in, it breaks that kind of eternal loop, and it enables people to have space to actually think about what they've just said, and that's all part of the healing process. I don't cure people. They heal themselves. I'm there to kind of to get their body to heal itself. People come in and this is their comfort zone. Often they're just a little bit over here. And all I'm doing is saying, well, it's a little bit better over here. And just trying to move the person back into that place where everything's working properly then.
And we call it acupuncture, we call it Chinese medicine.
Yeah.
But it originated in the political entity, which later was named China.
Yeah.
But it's a human medicine, so it's universal, and allows the space because it's based on experience to begin with, human experience. So it allows that to come out. So again, we don't have a brilliant word to name what we do, because none of the words that we have encapsulate this incredible thing that gives you enormous amount back as a practitioner, as much as it gives to a patient.
Oh my God, yes. I mean, that's one of the most rewarding things about being a practitioner, is that every treatment I give to someone else is a treatment I give to myself also. That as I'm needling, that is the only time I'm ever truly 100% present. I am just there. It's just me, the needle, and the client, and that's it. And just that little glimpse of that kind of perfect beingness is absolutely amazing. And that happens multiple times a day, and people pay me for it.
Well, what better way to end a conversation on that, Paul? So it's been a real pleasure. Thank you for having this conversation, because I think it's really important to have a perspective of practitioners who've been doing it the way through their lives. And I think it's such a common thing. It's so interesting to see that we have a very different definition of retirement in our field, because we get so much back from it. There's way more people I know who are just practicing, even if it's a small amount, into their retirement. They're not because it's something that now becomes part of you, you could, after starting telling everyone it's incredibly hard to do. We're supposed to be encouraging people. No, but
the whole thing is it is such a rewarding thing. 100%. That if you study Chinese medicine properly, it is going to change the ways that you feel about everything. It's going to change the way that you look at the world. It's going to change the way that you think about your place in this whole whole thing. And if it's not doing that, then you haven't studied it properly.
And that's it. I think that to promote our courses, right? But the thing is that very smart people came together 35 years ago and set a standard. Because we were asking, how do we have a course that properly has space to express all of this in and sets you up as a practitioner for the future? And the answer is the structure of the British Acupuncture Accreditation Board courses, City College being prime example, right? And and again, that's quite hard to communicate, as hard as it is to communicate the vastness of what we do. And I think that once you get on the course, you start to understand. Yes, I really needed this space. And also, you get to love that challenge, because the challenge is something that is going to give you so much at the end of it. So, absolutely. So if you're interested in studying acupuncture, do look at the our British Acupuncture Accreditation Board courses on baab.org.uk, or check out City College of Acupuncture in London. But with that, thank you very much, Paul. And I hope to see you at another Cultivating Tradition podcast.